Hi, everyone. This is Glenn Woodworth with the Society for Education in Anesthesiology. I want to welcome you to another one in our podcast series on educational innovations. And today it's my great pleasure to have on our podcast Joss Thomas. And Joss is an associate professor and vice chair at the University of Minnesota Department of Anesthesiology. And today he's going to talk to us about a great project that he's been working on. And so Joss, welcome. Thanks for showing up today.
Thank you so much, Glenn. It's a pleasure to share this information and share this experience that we have with this particular project.
Okay. So why don't we start out, and this is kind of how, when we're talking about an educational innovation, this is one of the ways I like to begin, which is what was the problem that you were trying to solve?
Well, I think QA and safety training for our residents has been a requirement for all the ACGME residency programs. And it has been a problem that has been recurring for every year of our residency to try and find an effective and efficient way to address the requirements and also make it meaningful for our residents. And we also recognize that if we do add additional stuff to our residents, their clinical loads and their current didactics and teaching curriculum already takes quite a bit of time. And real-time didactics to teach our residents a QA and safety training was going to be quite a challenge in the midst of the curriculum that was already developed for the anesthesiology training.
So you brought up a couple of things. Let's just kind of address that. First, can you talk a little bit about the program requirements that say we have to do QA and safety training for our residents? How did you interpret those requirements? What did you think they meant?
Well, as much as it is a requirement, I believe that the ACGME has given us quite a bit of latitude on how to interpret that. But the essence of it is that the residents should have fundamental knowledge of QA and safety concepts, and they should participate and carry through a QA project through their residency. And they should have some tangible evidence of completing a QA project, whether it is a presentation or a data collection or actually designing a program, QA project.
Okay. I would point out that that's true also for the fellowship programs. So what you've developed also could apply to fellows, have similar requirements in their fellowship program requirements put out by the ACGME.
Correct. And that's why I think it has applicability, although we are using it within our anesthesia realm, it has applicability to all specialties as well as the fellowships.
All right. Well, I'm excited to hear a little bit more about this because obviously this is a problem that we're all trying to solve. I think many of us have been trying to make use of some institutional resources to try and be able to solve this problem, but we're going to be interested in how you can really help us. The other thing that you pointed out is one of your challenges right from the get-go was how to do this project with the impact on the residents' essentially time, because they don't have a lot of time to do things, or does it mean you're going to have to take something else out of your curriculum to make space for this?
That's a very good question. And what we understood, especially from resident feedback, is adding more to their plate may not be an effective way to help them learn new concepts, although it is sort of a requirement for the ACGME residency programs. So what we were trying to do is not burden them with something like this. At the same time, give them enough latitude and flexibility to learn the concepts on their own time within the framework of a course. And that's why we moved to an online system rather than having real-time didactic lectures or workshops associated with QA projects.
All right. Well, I suspect this is going to be a combination of online learning as well as, the in-person activity. So I think maybe it's you've whet our appetite. We should get into the meat of it. So tell us a little bit about what you ended up developing.
Well, it all started because I took part in the executive MHA program at the University of Minnesota. And one of the courses that we had to complete was QA and safety. And this was actually a course that was designed and developed by one of our medicine professors here, Karyn Baum, and she's actually the current vice president and system clinical operations person at mHealth Fairview. So she does a lot of work with QA projects. So when I finished the course, I found the course to be really useful, and it was quite enjoyable to do. So I sat down with her together with our vice chair of QA, Professor Joyce War, and our program director at that time, Professor Moitza Remskar, and we wanted to figure out whether we could adapt this MHA course to our residents, basically making it a simpler version and use it for our residents. So basically, Professor Baum was very, very open to helping us use her material. And since the course was already online, we already knew that its applicability and flexibility to use within all the residents or within the realm of the residency program was going to be quite logistically easier than establishing a new course by itself.
Okay, so that was helpful that you had sort of a starting point.
Yes.
Okay, well, so what did your program end up looking like? What were the components of it?
So essentially, we adapted the course to make it simpler for our residents. Especially with even though it was an online course, we had assignments set up, which included reading articles as well as one discussion forum that was done for every week for a 6-week program course. But the essence of this was that we had to transfer the course material to the Canvas platform, which was a new platform that the university started using instead of Moodle, which was where the executive MHA program was set up on. That being said,
I'm going to interrupt you just for a minute, just so our audience gets a little bit better idea of this. We'll talk about the challenge of having to move from Moodle to Canvas in a minute. But So what were the elements of this course? You're saying there's an online portion. What were the online activities that the residents would be engaged in?
So it's a 6-week program. And what happens is every week there will be an article to read and a discussion forum where a question in the form of what kind of QA problems do you face in your institution, or can you give us an example of an aim statement after they go through each week's course material, which is a PowerPoint presentation that they can read online.
So each week would have something to read, an article to read.
Yes.
Have a PowerPoint essentially to go through.
Yes.
Just some slides to go through.
Yes.
And about an hour, or how long would it take them to go through those slides?
Those slides, probably 20 to 30 minutes. We did not want to overburden our residents.
Okay. And then the last piece, and there may be others, but the other piece that I heard was then you would, a facilitator in the course would facilitate a discussion applicable to whatever the concepts were discussed for that week and try to bring it into the real world about what's going on in their department or how they could apply what they had just learned.
Absolutely. And this was a facilitated or moderated discussion forum, which was mandatory for the residents to participate in. And the essence of the way it was designed is following the executive MHA program, where every week on a Thursday, you have to submit a posting based on the concepts that you had identified and based on the question that was asked. And then each of the residents had to respond to any one of the other postings that their colleagues had posted. So it basically started essentially a discussion about what they posted and they commented on stuff that their colleague residents actually posted as well.
Okay.
And this was sort of time sensitive in the sense that they follow a certain pattern that every Thursday they post, and by Sunday of that week, they have to respond to a post of their colleagues. And this worked pretty well.
Was that the only 3 components every week? those three pieces?
Yes, it was.
Did the facilitator ping people to say, hey, I see you haven't posted anything or you haven't commented on anybody else's stuff? Did they try and encourage the participants to get going?
Absolutely. I mean, one of the things that we did emphasize was the timeliness of the posting, but we also recognize that, residents do have challenges, and if they do inform us earlier that they will post their postings a little later, it will be okay. They will not get penalized because each of the postings and the assignments, there is a rubric that was developed by Karyn Baum that we adapted, and the residents know what to do and how it is going to be graded. So even though it was graded because it was done for the first time, we were not so keen to be such strict graders. We just wanted the residents to be encouraged to post. But if they posted late and they did not have a good enough reason, some penalty points would have been subtracted. But for the most part, our residents were much on time. So
we'll come back to that assessment piece in a minute. Yeah. How many participants did you have in the course? Was it designed for 3, 4, 10, 20? How many residents were you targeting this for each course?
So the first time we envisaged this course, or when we started this course, it was only for our residents, and we had 7 CA1 residents. That means residents who were part of the clinical year 1 of anesthesia. So we had the experience of that cohort of residents, but now this year we expanded this course to involve the CA1 residents of 4 other institutions. That was University of Wisconsin-Madison, Medical College of Wisconsin, Milwaukee, University of Utah, and University of Iowa.
Would they all be participating together? And, so that might be somewhere around 40 in one group, or were you just each?
Yeah, that's a good question, because what we did was we had about 80 residents participating this year. And what we did was for the sake of the discussion forums, we divided the residents into 8 groups of 10 each. And each of the groups were well represented by each of the institutions. In other words, residents would be posting and responding to posts of residents from other institutions for the same concept or the same assignment.
Were they all 80 residents going through the course at the same time, and then you just divided them into these subgroups for discussion purposes?
Yes, it was going at the same time. And actually this year, the course actually started on October 5th. It's still going on. We're in the 5th week of it, and we have 1 more week next week.
Okay, awesome. Well, tell us a little bit about, how, you've done it a couple of times now, at least twice, right?
Yes.
Tell us, how it went. What did you find it worked well? First of all, what worked well?
Well, I think, the residents of our time, at least the present time, are pretty savvy with media, such as Canvas or Moodle, and they gravitated very easily to the online learning experience without much coaching necessary to learn how to use the Canvas platform. And I think that is common to most of the residents. We didn't have to give them much coaching to learn how to use this platform.
Okay.
And they were able to post very easily. They were, in other words, the technical aspects of it was not a problem for them.
Okay.
And that being said, they were very savvy about putting their posts on time, reading and doing their assignments. But the flexibility that was within the fact that it was an online course gave them the ability to do the assignments at whatever time, even at midnight when they're at home. So that gave them the flexibility. So that was the first thing that we noticed, that even though we as faculty may have had a little bit of a challenge learning the ropes of Canvas, it was much easier for our residents.
That same thing with operating the remote. So, all right. So tell me a little bit about the engagement level. How did the discussions go? Were they, Did you find that discussions were dominated by a few people in the group, or did you get active participation amongst all members, maybe because of the stick that you had behind it about grading? Or tell me a little bit about that discussion engagement. What did you see?
We were very pleasantly surprised by the level of engagement by the residents and also the thoughtful responses and the insights our residents had on some of the issues related to what they were experiencing. And, they brought up some very good points about how to, why are the cases starting late in the OR, hand washing, basic QA projects that of problems that could be identified as ways to improve. And these were real problems that they saw within their institutions, and they were able to share that issue with the residents of other institutions. It was also interesting that many of the problems that we see in say the ORs or in anesthesia are pretty common, and it's not unusual to have residents talk about very similar issues, although they are distinct in the sense that the institution is dealing with it in a different way.
So I like the idea of multiple institutions participating because they got to, first of all, interact with their peers at other institutions.
Yes.
They probably appreciated the commonality of problems that they face, but then they also got to take advantage of maybe unique solutions or perspectives that each institution had. So I think that's really cool. Well, those were some of the things that worked well. Was there anything that didn't work out so hot? What did you find was a problem, or something that maybe you had to change from the first time you did it to the second time you did it to try and improve the project?
One of the things that we had to be careful about was the copyright issues of the articles. And the way we circumvented that was that the articles would be accessed through their individual institutional libraries. So we created links. Say, for example, University of Iowa residents would go through the University of Iowa library to go to the article. So this would then prevent us from violating any copyright rules with regard to the articles that might have some copyright issues. Then the other part of it was the actual registration process. While Canvas works very well within the system or the university itself, when outsiders access the course, because the course is not a paid course, in other words, it's not set up like a MHA program or an MBA course, we had to circumvent that by contacting the folks in Canvas to say, this is a course that our residents are going to do. This is not a course that people have to pay for. How do we get them to register and access the course within the Canvas platform of the University of Minnesota? So we figured this out, but it is a little tedious because each resident of every institution will get an email and instructions on how to register to the course. For example, if it was, say, an outside course which was paid for, all the registrants could be what you call registered en masse. So it wouldn't be a problem. If they paid for it, then they just get registered by us. But because we had to do this, each of the residents and the faculty have to register by themselves.
So they got an email from the system. That doesn't sound too bad. And they just had to click on it and register. So that didn't sound too bad, though.
It's not too bad, except that you know how the system is. How many emails do people get? And how many people really respond to an email?
Yeah.
So we had to give multiple, we expected that, so we set it up in such a way. We had a teaching assistant that was set up for the course, and her name was Ananda Anabarasu. She is actually a student of the School of Public Health, and she's doing her master's program, and she really did a good job in following up with the faculty as well as with the residents, giving them gentle reminders. Hey, you haven't registered yet, the course is going to start. And 95% or 98% of the registrants actually were in the program by the time the course started.
All right. Let's talk a little bit about faculty participation, because if I was running this at just my institution with just 8 or 10 or 12 residents, It
Yes,
sounds like it could be run with just one faculty facilitator. Is that correct?
correct.
And
So,
is
yeah.
that a requirement for that faculty facilitator, though, that they would have gone through the course like you have, or have some special expertise? In other words, if we want to replicate this at another institution, the faculty running this, do they have to have special expertise in quality improvement?
Fortunately not, but we did have additional support when we set it up for the different institutions, that we had quality engineers from each of the institutions to help the faculty if they did have an issue. Most of the faculty would be able to moderate the course just by looking at the PowerPoints and reading the article themselves, and then they would be able to moderate the residents' discussion forums quite easily.
Now,
Yeah,
just to make sure I was clear, though, that if I was running this as a small course, then it would only require one faculty. Is that correct?
absolutely.
But in your model where you're doing multiple institutions and where you had 80 residents, did that require one separate faculty for each one of the discussion groups, or did you have one faculty? How many faculty did it take?
So we wanted maximum faculty participation in this course. So what we did was we did request all the institutions to provide faculty or volunteer to do this, and we got a really good response. So yes, you're right that each week we had one faculty moderating each group. So up to 8 faculty were available for each week. Some faculty decided to and offered to do more than 1 week. Most faculty were comfortable just doing 1 week. And I think that's an important aspect, that if the course is 6 weeks long, it would be better to assign one faculty per week so it doesn't get too burdensome for that one faculty.
I see. So a pro and a con that we would lack continuity. So even again with my small model of just my residents going through this, instead of having one faculty member for all 6 sessions, you would make it a different faculty member for each session. So there'd be a loss of continuity, but the burden on the faculty for moderating the course would be smaller. Did you get any sense of how much time it took on the faculty's for the faculty to moderate a session? What did that take? Did they say it took me a couple of hours, spread out over a few days to stimulate the discussion, or, did I have to spend 10 hours on it? What was the faculty commitment?
So the way we designed it and the way we sold it to the faculty is that it should not take more than 2 hours a week. If you have already done the reading as well as the PowerPoint. Most of the discussion forums are very straightforward. And the intent of the faculty is to, one, encourage the discussion forum, provide some comments, even steer the residents to another article if they can, because based on the way they had put their comments in. But the intent was not to make this too burdensome for faculty. So it should not take more than 2 hours. And now that we are in the 5th week of the course, I have not had any faculty complain about the workload. Now, that being said, we have encouraged the faculty to engage as much as they can. So some faculty responded to each and every comment that a resident made. Some faculty responded to a few of the comments and made comments in general, and both were acceptable.
Okay. So it sounds like maybe an hour of prep work to read the article, go over the PowerPoint, and then maybe 2 hours to moderate the discussion. How about on the resident side? Roughly how much time did they tell you that they were putting into this per week?
We got some feedback from the first time our CA1s at the University of Minnesota did that. And one of the things that we noticed was they were not too overwhelmed with the course contents, but they were very particular to give us feedback about the timing of the course. And this, what happened was many of the residents felt that because they started in the OR, that would not have been a good time to start the course because they're just getting their feet wet in the OR and they were just a little overwhelmed at that. So what we did was we moved the course from July to October. And so far, none of the residents have said that they're overwhelmed. I think This was a discussion from based on the input from all the program directors, and they all felt that October, November was a good time to start the course.
Yeah, that sounds reasonable, and that sounds like good feedback and a good change.
Yes.
Did the residents tell you anything about how much time they had to put in it per week? They probably also had to do a similarly 1 week, an hour of prep to read the article and go through the PowerPoint, but
Yes.
they probably didn't have to spend as much time in the discussion. You know, maybe, did they tell you anything about how much time they spent?
Well, that information is not very clear to us. We just had an interview process where all of them were sitting with us and we just discussed. They said it was about 1 to 1.5 hours at the most.
Okay.
A week.
All right, good. Well, that kind of brings up the very next question, which is, measurement of outcomes. So you talked about, a grading scale, but it sounds like you've also done some debriefing. Maybe you did some surveys. Maybe you're planning to do a survey with this big group. Can you tell us a little bit about how you did any outcome measures for this project?
So one of the good things about Canvas is that it does measure engagement by the number of times they log in and how long they have been on that site for that particular week. We are still learning how to interpret that data. And we are working with the University of Minnesota Canvas experts to try and figure out how useful that data is and does it really give us a true reflection on the level of engagement for the residents. The second part is, yes, the discussion forums were graded on a rubric that was designed on saying these are the expectations of the rubric. For example, if you have an aim statement, the concept of aim statement, it has to be succinct, it has to tell us all the elements, and it has to be precise, it has to be unambiguous. So the residents got to know how to use the rubric very well. And then for this year, we actually sent out a survey, and this survey was developed at the University of Utah by Emily Drennan.
Can I back up and ask you a question before you go through the survey?
Yes.
Was the rubric provided to all of the residents? So I guess each question had a rubric for it. Is that correct?
The questions did not have a rubric.
Or each week session had a rubric?
Yeah, each week session had a rubric, and they already learned how the template for the discussion forum was going to be graded.
So they were provided with that week's rubric as well as part of their material. So they knew in advance before they were doing their postings.
Yes.
Okay, great.
We also decided that the rubric will be, will have minimal changes from week to week unless it's an assignment. And what we did was we gave more latitude for the residents to interpret the QA problem, because in reality, even though we learn concepts, in reality, the interpretation of those concepts can be different based on the institution and the resources that you have. So we gave much latitude to that. Okay.
Now, I'm sorry I interrupted you, but now we're going to go on to talk about a little bit about a survey. Can you tell us about that?
Yeah, the survey was set up by Emily Drennan from the University of Utah, and we had requested that the survey be IRB approved. So each of the institutions did submit it to the IRB for clearance. And we did get clearance from the IRB from various institutions. And this survey is basically trying to assess their knowledge of QA and safety prior to the course.
Okay, so was this a pre and post survey that you did at the beginning of the course and at the end?
Yeah, the course has not yet completed, but yes, we are going to do a post survey at the end of the course.
Okay, all right, fantastic. Well, this sounds like an awesome project that we could all benefit from. Let's try to talk through what it would be required to make this generally available so that we could all take advantage of it. It sounds like at a minimum, what could be done is, and I don't know if you're willing to do this, but if you made available the rubric, the PowerPoints, the questions for each week, and the survey, then we could leave it up to each institution as to how they would put the course on and run their discussions. But that sounds like a package that it would be fairly straightforward for programs, because they could do it in person. I mean, they could even just be, the discussion could be held in a room. Or if they had the technology like Canvas or Moodle, they could figure out how to host the course and the discussions online.
Absolutely. I think what we are going to learn is the experience of having our residents work with residents of other institutions. I think this is the first time this has happened, at least for a QA and safety course. And I'm not sure, we are hoping that this experience that the residents will have with other residents of other institutions has a value that may not be appreciated if they do it within their own institutions.
Right.
At the same time, yes, adapting this to an institution is pretty easy. The important thing is even some of the examples of the QA problems or the safety issues can be adapted to what the institution is facing.
Okay. I hate that, I don't mean to put you on the spot. But I'm all about, trying to help all the institutions. So would it sound like this is something that maybe we might be able to post as resources at the SCA, the elements for each week? Is that something that we could do, so that way other programs would be able to access this information?
I'm more than open to that. I just have to talk with our program directors, as well as Karyn Baum, who was, this is her course initially, even though it's adapted. She has been very open to having this access to many people. We just have to make sure that as it becomes open to other institutions, we make sure that anything on the PowerPoints are not copyrightable or any violations of that. That's the main thing that we think is an issue. But in terms of sharing the information is not a problem.
So we need to get permission from Dr. Baum, but then you said the PowerPoint needs to be checked over just to make sure that they didn't use any copyright images or anything like that in the PowerPoints.
Exactly. We've gone through that with a fine-tooth comb, especially because now we have 4 institutions. But I think this course needs to also be updated for whatever the issues are for that particular year. And that's the good thing about this. The concepts remain the same, the contents can remain the same, but the problems and the assignments can change based on what are the issues people are facing. Right.
So an individual course director might know what's a hot topic. Maybe it's PPE this year. They could adapt the questions. That's a fantastic. Well, Joss, this is an awesome project. I think you've done, amazing work. And what I really like about it is that it's replicable at other institutions. That's important, I think. Is there anything that I missed or that I forgot to ask you about, maybe that you would want to share about this project?
Well, I think, this has been a huge learning experience for me personally, and it has been amazing because of the level of support from the chairs of each of the institutions, the QA engineers, folks, faculty and residents, and the program directors for each of the institutions. They have been absolutely, forthright and engaged and helpful, and we have worked through many of the challenges based on the fact that we have a good crowd of folks who are really interested in making sure that our residents get a good experience and get good fundamental knowledge of QA and safety concepts so that they can apply it wherever they go. Because I think, as you said, my hope is that this is not just for anesthesia, it would spread to other institutions and other specialties. It would be nice to see if our residents can have discussion forums with residents of other specialties, because the same problem might be seen from a different angle based on your specialty.
Yeah, I think that's a great point. I thought of that as well. So even if we did it here at OHSU, we might not be able to do it with UC San Francisco or Stanford, but perhaps we could do it with the internal medicine department or something like that. The cross-fertilization there would be just as important. It also occurred to me that, your running of this project and maybe your next steps, what you want to go for, I would think that this might be a good one to apply for an Anesthesia Patient Safety Foundation grant. So if you had a young faculty member that wanted to take this to the next level and do something, I would encourage you to take a look at that as a possible opportunity.
Yes, and we also in our institution, the global health team of different specialties are looking at this course to see if it can be applied, because it's an online course, to other countries. Because the concepts remain the same, but it could be, and especially now that global health has taken a huge toll because nobody can travel to any country now, education for residents of other countries in anesthesia in the developing world is also something that we are looking at, because with COVID, many of the projects have stopped or are in limbo until travel can be reinitiated. In the meanwhile, we think some courses of this nature may help the residents of other countries as well.
Well, I think that's a great idea. Offline, you can send me an email. I can give you some contacts at, for example, at the World Federation Society of Anesthesiologists or anesthesia programs, that they would, WAFSA, I think, would be interested in this as a possibility. Well, I think this was fascinating, right up the alley for the SCA Innovations podcast series. Thank you so much for joining us today. You've done great work. I'm super excited about it. I think it's a fantastic project.
Well, thank you so much, Glenn, for giving me this opportunity to share this project. And I hope that other folks will find this useful. And we are hoping to be able to share this with others, as you have said. And this is something that I think our residents and our faculty will be finding very useful.
Fantastic. Thanks again, Josh. Thanks for joining us today.
Thank you so much. Appreciate it.